into your operatory, the day is just starting, right? The day before you broke down the room, cleaned the room, straightened everything up, closed your room off, right? Now you're coming in for the beginning of the day. At the beginning of the day, you have to make sure everything is ready to go and working properly so that you don't have any hiccups during patient care. That's why we're having this dental equipment progress check. So the first thing that you see on here is your safety check. So no matter what, when you first walk into your operatory, you're gonna wanna wash your hands. That's gonna be the first thing you do. This is first thing in the morning, so you're not where you're gonna be putting on PPE, but you just came from the house, you just got out your car, you just changed your uniform, you touched doorknobs, you did all this stuff prior to getting into your operatory. So always the first thing you wanna do is just wash your hands. It's always good practice to get in to wash your hands whenever possible, right? I know a lot of people like to use hand sanitizer throughout the day, which is fine up to a certain point unless you see your hands are visibly soiled, but it's always good practice to regularly get really good hand washing in, okay? So I wash my hands, right? I come in, the first thing I want to do is do my safety check, and it says here that I want to check for frayed cords, defective plugs, defective cord outlets, right? So this is not a long process. You're going to do a general scan, right? I want to look, okay, I see my outlets are here, I got my plugs, right? Nothing looks like it's falling apart. I got my outlets, plugs here. All right, my chair is, you know, good. Doesn't look like anything's going on wrong here, right? I don't see any frayed wires sticking out, right? Okay. Just generally, I look over at my computer. Everything's good to go here. Nothing seems out of sort, right? So then I'm gonna go specifically to my dental chair. So then I wanna look, before I go on for safety, you wanna make sure your floor is clean and that there's no safety hazard on your floor. What if your chair had been leaking overnight and you didn't know, right? It had a leak in it. And you walk in and you notice there's a puddle of water here on the floor. Well, you gotta find out where that source of water is coming from, right? That's a safety hazard, because if you don't take care of it and you don't find out what the source is, your patient, you just mop it up. Next thing you know, you're trying to seat your patient and your patient is slipping and falling on water, right? That's a safety hazard. If you have debris everywhere, you got boxes everywhere on the floor, that's a tripping hazard, right? So first thing first, check to see if you see anything out of sorts with your wires, your plugs, your outlets, and make sure there's nothing on your floor that could be a hazard. Next thing we want to do is we want to demonstrate the safety plate function for the dental chair. So then we have to turn our chair on, right, in order to demonstrate that function. Safety plate function. So remember we talked about that the unit has like preset options, right? And it has like the arrows where you can change it yourself manually, right? So let's say you have the foot pedal and you want to check the safety plate function. I would just pick one of the preset options. What I like to do is just bring it all the way up to maybe about right here, because the safety plate is underneath the chair, so your foot has to be able to get to it in order to hit it, right? So I hit one of the preset options. It stops it and brings the patient up or whatever to get and just stops whatever process it was in the middle of, okay? So if you can't really tell what I was doing, I'm gonna bring the chair all the way up and then I want y'all to come back here and take a look at the safety plate. This right here is your safety plate, right? So I'll demonstrate that again now that we know where it's at. Let's say 1, and it stops it. It brings it to a neutral position and then stops it. Stops it, right? This is a way, this is like some type of way to help you in case, let's say your hands are dirty, you have sharps in your hand, right? This chair is moving, but it's not moving in the direction you want it, and you want to stop it. You can't grab the patient. You can't touch the patient because you got you're contaminated, right? You don't want to start rubbing blood and stuff on this patient. So you can hit this option as a way to stop the chair, right? It's a safety option for you. Okay. So then the next thing we're going to talk about is the swivel bracket to rotate the patient. Oh, y'all didn't have to move. I was just trying to read the next line. Y'all got to see this. Right, so the next thing is going to be the swivel bracket. Bring this down a little bit. If you look here, there's this bracket here. This bracket, when unlocked, allows you to move this chair around and swivel it so that you can position the patient in a way that will allow for optimal patient care for the room that you're in, right? So you think, oh, the chair is always going to be like this. Not necessarily. We have these same chairs on the ship, but because of the ship environment and how the rooms are shaped, most chairs don't sit like this, especially in the hygienist rooms. The chairs set like this, kind of like this, right? If we didn't have that swivel bracket, it would be nearly impossible to get the chair in there and have enough space to work, right? So this allows you to be able to angle the chair. So you will just demonstrate, we'll say, okay, where's the swivel bracket, right? You'll go to the swivel bracket, loosen it up, show that it's swivel, lock it back in place, right? That shows that you test the function, and then you know how to lock it back in place. Y'all got that? So the next thing is going to be, somebody read the next step for me.
Activate handpiece toggle.
No. The foot switch.
Foot switch. Place patient in supine position.
So what's the supine position?
Lying down.
Laying back, right? So you want to bring the patient down. Using the foot switch, you bring the patient down, right? And then I'm going to lay this patient back using the foot switch. I don't know what happened to this space. That's crazy. All right, so I demonstrated that I'm able to bring my patient down and I'm able to lay my patient back with the foot pedal. So my foot pedal does actually work. What's the next thing? Now we're activating handpiece toggle switch to turn HTO on and off. So the switch to turn H2O on and off. Let me see this. So there's a couple of ways to turn on and off the H2O, but for this particular one, what they're talking about is the switch on the rheostat. The switch on the rheostat has a water button, right? It has a toggle switch. I think they switched these up. So there's a switch. Come on this side for me. They switch these, the yellow and the blue. The blue should be on the other side. This is your toggle switch for water. That will turn your water off. That will turn your water on. Somehow, whoever was doing maintenance on this switch, the yellow and the blue. Yeah, it's correct on that one. The blue, it should be on this side. So, towards the dot is turning the water on. Away from the dot is turning the water off. So your rheostat has a switch that will prevent water from coming to the hand pieces or allow water to come to the hand pieces. Okay, and you'll just have to show that. Okay, what's the next one?
Activate arm brake.
Huh?
Activate arm brake.
Okay, I want y'all to one line there. Activate arm brake does not apply to this chair. The arm brake is something that used to be on old chairs that would lock the arm, right? There's no arm brake on this chair. It's like a screw thing. I think we didn't realize it until later when we were going through validation that was something that was on an older chair, but does not apply to this chair, right? This does not have an arm brake. What's the next one?
Flush toggle storage lines on the sink.
Okay, so now we're gonna go about flushing our lines, learning how to flush our lines. So in order to take your bottle off and get water so that you can flush your lines, you're gonna turn your chair off, right? Then you have to rotate your bottle, and it gives you a little image on the side of here on how to do that, right? How to rotate your bottle. Rotate your bottle. If you do not turn your chair off before doing this bottle could fly and injure you. So please do not try to take this off or put this on the chair form. Okay, everybody follow me so you'll know where to get water from. Come on. This is where you're going to get water from in order to flush your lines, to test your lines and purge your lines, right? Because you'll actually be purging your lines in both the equipment and the infection control. So you'll have to do it twice. So just get a good, you don't have to fill this bottle up, just get a little, about right here, right? It doesn't have to be too much.
Now, if you're actually seeing patients, you would want to fill that all the way up.
Yes. Yes. If you are seeing patients in a clinic, you will fill this bottle all the way up. Now here, we let you get distilled water from this machine. It distills it and all of that stuff, and we get it from here. Most clinics, they don't do this. Just like HM2 was telling you, there's tablets called ICX tablets, where you place the tablet in the water, and your water comes out of the sink. The water comes out of the sink, and then they just put the tablet in there and they put the bottle on the chair. But here, you're going to come to this distilling machine and get your water, okay? Let's go back. Okay, so we now have to test the purging of our lines. Is that what it says? The flush toggle, purge lines over sink. So the flush toggle is going to be this switch on the back of your bracket tray. So remember yesterday I pointed this out. You got it on the video?
Yeah.
Okay. So you'll take your hoses. You're gonna press this toggle down, and you're gonna wait until the water starts coming out. So now y'all see, one of the hoses will not have water coming out of it because the water portion is blocked. That's gonna be your slow speed hand piece hose, right? Because you do not have water going through your slow speed. But usually the hoses are kind of like, they're kind of like entangled. So a lot of times you don't know which one is which, so you just grab all of them. Save yourself time trying to stop. Don't try to figure it out. Just get it, hold it. When you see the water coming out, okay, it's working. Okay?
How long in the beginning?
Well, yeah, 1 minute is to get another day. During the equipment one, you won't have to do it for 1 minute. During the infection control one, you will. Okay? This is just you testing the equipment to make sure it's functioning properly. So, what's the next one? Now, for the three-way syringe, right, you might want to use a syringe tip. Not mine, go ahead and use a syringe tip. Remember, press that outer ring in, press it, pull it, and then it's back in place. So then you're gonna test the water. You're gonna test the air. Then you're gonna test the mist. And the mist is holding both buttons down. You can come on this side because you're not. So again, you're gonna test the water. You're gonna test the air. You're gonna test the mist. Right? And then not only do you want to test this one, but you also want to test the assistant one. Same thing to remove it. You're going to press the ring in, pull it, let the ring come back out. Remember I talked about using the HVE? Water, air, mist. It's working, right? What does it say next? Huh?
And then light.
Okay, it's not drifting. Right? You turn the light on. You make sure it's not drifting by moving it and see if it moves on its own. Moving it, see, nope, it's not drifting, right? Now I want to check and see if the light will go dim, right? Because we have the on-off light switch and then we have the dimming light switch, right? The dimming light switch is going to be this right here at the top. You're going to flip it up, flip it to the middle, and then we're going to flip it down, right? And then you see the light difference when you go down, it dims. So you have to demonstrate that you know where that dimming light is.
From earlier, what you said which one is the light shield? Is the
Oh,
one
okay, yeah.
immersed in water?
So, see these two tabs on the side? They come up. This is the portion you're going to wash. Right? This is the portion that is stationary and that you're just going to use a lint-free cloth to clean. This inside portion. And then you use what to grab this bolt? A dry towel, because you can't use your hands, right? Why is that? The oils on your hands, right? To reduce or decrease the life of the bolt.
So this is your curing light shield. This is where I made a mistake this morning telling you guys. So curing light shield, okay? That is the dental light shield.
Yeah,
for the
this is the light shield, right? That's the curing light shield. Okay. Okay, so where am I at? So you're basically checking to see if it's drifting, which I showed you. Check and see if bolt needs to replace. If the bolt comes on, does it need to be replaced? No. No. If the light is working, the bolt doesn't need to be replaced. Ensure the light shield is clean, right? So we take it off, we look at it, make sure it's clean. We look in here, make sure it's clean. If we find that it's dirty, right, we go through the steps of cleaning the light shield, right? And then you just have to verbalize how you would clean it, right? I need to clean it in cool water. I need to wait till it cools. Warm soapy water, lint-free cloth to dry it, that kind of stuff, right? Remove the bolt with the dry towel, right? And then use lint-free cloth to clean the light reflector. Okay, you have to verbalize that part. We won't have you actually doing that part. You'll just say it. Okay, and then check dimmer switch, right? And that's this portion right here. That is the dimmer switch. Up, middle, then down. Down will be the dimming portion. Now, let's talk about the slow speed handpiece. At the beginning of your appointment, you will have to get handpieces for your provider, right? Depending on the procedures, depending on the handpieces they will need. But they will always need a slow speed and a high speed, right? Some of these hand pieces, the motors will come separately, but not the ones we have. The ones that we have, the motors are already attached to it. So what you'll do is you will take the slow speed and you will place it. Usually the slow speed is the last hose. Also, if you look on the inside of this hose portion, it's kind of hard to tell, but the part where the water would come out of is blocked, right? But it's kind of hard to tell you the truth. But you'll place it, you just line it up, gold to silver, right? You'll see one portion inside is gold and one portion is silver. You'll just line this up. One of the portions is smaller, one of the portions is larger. Just line it up, screw the hose on, right? And then same thing with the high speed. Place it on here, screw it on. All I'm gonna want you to do is screw it on for me, right? And show me that for the high speed, it should be water and air, which will show on your screen. Water, air. You see the W and the A? I'm gonna bring it around. It should say water and air on the screen. That's how you know both are available, right? Then, if you can't see, can you? You see how it says water, W and A? That stands for water and air on the screen, right? That means that this piece that I'm holding, water and air should come out of it, right? Whereas when I pick up the slow speed, it should only be air. So if it has water and air, then you got to turn the water off on here, right? And how do you do that? The water and air buttons are at the top, and you just simply turn off the water. Now you only have the A. That means only air will come out of this hose. So this is water, this is air. If you want water, you hit the button. If you don't, you turn it off. Okay, that makes sense. This is the water, this is the air. If you want water, you hit the button, that turns it on. If you don't, it turns it off. Okay?
But I would only have like that one. So you want like the
For the slow speed, you do not want water. For the high speed, you have to have water.
You can just check it. A high speed's gonna have the water.
High speed has to have water. Slow speed will not have water.
When you take it out, it'll tell
Okay.
you which one it looks like.
So then it talks about testing your high speed hand pieces and your slow speed hand piece. You will have in one of either your 1 or 2 drawer something called a burr block. In this block, there are different burrs and mandrels. You'll learn details about that when we go over instruments. But you'll just take a burr with no latch on the end. So one that has no latch. And that one will go into the high-speed handpiece. You'll press the button on the back of the high speed, place it inside of the handpiece. Make sure it's seated. Okay, it's in there, right? Your slow speed, on the other hand, requires a burr that has a latch.
They're gonna be thicker.
They will be thicker, and they will have divots at the end of them. Can you see it
Yeah.
on here? Or is it better like that?
I got it.
Okay. Okay, and then you'll place that inside of the slow speed handpiece. Again, you place it on the inside. I don't think this is working. It's just demonstrate that.
See the difference between these two? Which one is the latch? Yes, it's this one. This is for the high speed. It's pretty thin. This is the fatter end, and it has a latch on it. That's how you know.
Okay, so how can you demonstrate that these work properly, right? So all you'll do, okay, I have my water and air on. I have my handpiece. I have my burr on it. What you're gonna do is make sure your water's on. Then you're gonna press your rheostat pedal. Your rheostat pedal is, remember we talked about, it is what pushes the air and moves the handpieces, right? Y'all hear that? You gotta hold it for a little bit because you need to make sure that the water is coming through. Might be one that doesn't work.
You grab another one, or you got another one?
No, I'm gonna put it on the other hose. It might work on the other hose. Yeah, a lot of our equipment has been ran through because it's a training command. So a lot of these chairs don't work properly. Which is why during the GA lab, we'll just carry our portion around. Let me see another handpiece. I really don't think it's the handpiece. I think it's this chair. Oh, you know what? Let me try this. Let's see.
Or you like these ones instead? Are these like better working?
I don't know. I don't know if it's the chair or if it's this I think they tried to fix this rheostat and they like changed a bunch of stuff around on it. Let's try this one. During the GA lab, we won't have y'all do this portion. We'll have to do it ourselves just because this is what happens a lot of times. Like trying to figure out which hose will actually work for us. Oh no, no.
It was off.
That's what y'all don't want to do now. I don't need y'all hurting yourselves. HM2, he good though. He been in the fleet. Okay, so at least I can show y'all the slow speed. You see, even though, whoa.
You don't want that to happen, right?
You don't want that to happen. This shouldn't be coming to loose, so this is damaged. This has to go to the BMAT.
Yes,
All
sir.
right. So, do y'all see why it's important to test your equipment at the beginning of the day?
Yes.
We're gonna move on from this. I'll get a different show for that part. This, exactly what we're going through at this moment, is the reason why you want to test your equipment at the beginning of the day. Imagine getting to your chair and everything was fine yesterday, and then you realize none of your hoses will let water come out, right? You gotta let your provider know, you gotta let the BMET know, you gotta try to get a different room, or you gotta you gotta constantly provide water for your provider during patient care, because they won't come out of their hand pieces, right? These are like main reasons. Like, this is exactly the reason why. Did yours work? This is exactly the reason why you have to test your equipment at the beginning of the day. Like, it's not even an option. Okay. But yeah, that's basically how you would do it. You will put it on the hose, make sure the water is on for the water in the air is for the high speed, and make sure air is on for the slow speed. I'm not gonna have y'all like turning it and all of that stuff, because again, I don't want that kind of stuff to happen on y'all. But you will just demonstrate, okay, putting it on is working. Yeah, so
Oh.
sure.
Well, I don't have the bird, but
Uh-huh.
oh, this is the you get the
Oh, I give you a latch.
make sure it's seated all the way, and then I'll just do this. I'll just do it
Yeah.
right here.
You see
Is
that?
the water gonna come out? Okay, and then it'll also spin. That keeps it lubricated, hydrated.
Y'all saw that? Okay, let's see how that works now. And you just want to make sure that the handpiece, the bird is spinning, and that water is coming out of it. And that's where the soap speed is spinning. Okay, so then what's next? We did soap speed, high speed, right? Central vacuum system. Ensure air is on, ensure proper function of HVE and proper function of saliva ejector. So all you want to do is just make sure that you turn it on and that it's working, right? You hear the air coming out, right? I know this is working stronger, right? I feel it suctioning on my hand. So all I'm gonna ask that y'all do is turn these on and test that it's suctioning on your hand. Is this suctioning my skin? Yes. That's it. It's working. Right? And then solids collector. Right? So all I'm gonna ask, because I don't want y'all taking the top off without during equipment check, because it's you're not PPE up at this point, right? All I'm gonna want y'all to do is point out where the solids collector is, right? Y'all remember where that is? Yeah, so the solids collector is gonna be right here. Can you see me?
Yes, I got it.
Okay, it's gonna be right here, right? And remember, the solids collector also has hoses attached to it. The HVE and the slow speed suctioning hoses are attached to the solids collector. If you forget, all you have to do is follow those hoses to the collector, okay? And then for your dental provider and assistance chairs, right? You want to make sure that your provider chair is rolling properly, that it doesn't have anything stuck in the wheels, that it goes up, that it goes down, that the backrest works. Okay. And you also want to do the same thing for your assisting chair. You want to make sure, right, it's working. The ring is not loose. It's rolling fine, right? The armrest is working properly. That it goes up. Well, this one might not go up, huh? Oh, you might have found a broke chair.
Try that one before.
See if one of yours will go up and down. Yeah, there we go.
This one.
So that paddle should make you go up and down, but this one's broke. this chair tomorrow. I mean, try not to pick this one tomorrow. Okay, so yeah, you'll just press that pedal, make sure it goes up and down, make sure your armrest works, make sure the ring is in place, and make sure your wheels are not getting stuck. Then you want to ensure your amalgamator is plugged in. So you have your amalgamator cord, plug it in, turn it on. There's a switch on the back of it that turns it on, right? Put a couple seconds on it, pick any one of the speeds, see if it comes on. Now you've made sure that equipment is working. Plug in your curing light, right? Make sure it's charging. Make sure it's on. Especially with the curing light, you can't wait till you get the patient seated to plug that in because it has to charge. Most clinics don't unplug their curing lights at the end of the day, but here you have to demonstrate that you do. Right? So, once you plug your amalgamator and your curing light in, right, and you make sure your amalgamator is working, you want to make sure that your curing light is working. And remember yesterday I told y'all you have to use the paddle with the curing light. You cover it, bring it to the area, set some seconds, you make sure the light is coming on. Okay, it's working. Right? I know my curing light is working. I know my amalgamator is working. Now, at the end of the day, right, and we're just going to have you verbalize this because right after equipment, you're going to go into your infection control, right? We're going to have you verbalize at the end of the day, you're going to make sure that your equipment is secured and unplugged. Now, right, we did our equipment. We came in, we checked it, we found out what was wrong, if anything was wrong.